Hello everybody, my name is Andreas and my partner's name is Ohini, and we will be discussing video number 2 for the initial discussion post. So let's get right into it. So the question 1 says to state several errors that I saw throughout the video, and I think a big error that I saw was a nurse that was coming in took medication from a nurse that was leaving in order to dispense it, and no! That's a big no-no. We don't do that. The Oost 3rd edition book says that nurses are to not administer medication that they themselves did not take out. And that's a task that's not delegatable, Jesus, to anybody other than the nurse who is taking care of that patient. So, yeah, that's huge. Don't do that. And I think another big error that I saw was the fact that the nurse came in and she didn't check his 2 identifiers. And I guess the patient was like not really in the mood for that. I guess he was kind of sleepy, so he was trying to give some pushback. But the nurse should have educated the patient and said, hey, the reason why I'm checking these things, and we're all checking these things so constantly, is because we want to keep you safe. And she should have still gone ahead and did that, especially since it was her first time meeting the patient. Another thing I noticed she didn't do is she didn't really introduce herself. She kind of stated, hey, I'm here, and started doing what she had to do. But like, who are you? Are you my nurse? Are you my doctor? I don't even know your name. So that's huge. Communication, introduction. Never forget the critical elements. And she also didn't do her own assessment of the patient. She didn't look at his labs, which she would have noticed that his I and R are really high, and therefore she probably would have held off on giving him the medication which caused him to hemorrhage. And she also didn't do like a full body assessment because he had a laceration on his arm. So maybe that would have been a cue to be like, hey, let me use my clinical judgment and not do that as well. It's, you know what they say, an ounce of prevention is more than a pound of the other one. Okay, moving on to question 2. Question 2 says to indicate how using the 6 rights would cause a positive outcome. So in this instance, let's back it up a bit. What are the 6 rights of medication administration? And for those of you who don't know, the 6 rights of medication listed in the 11th edition McQuestion Pharmacology book states the 6 rights of medication administration are important goals for medication safety. The nurse following these guidelines will verify the following: the right patient, the right drug, the right route, the right dose, the right time, and the right documentation. And then it goes on to state how these 6 rights have been added, more rights to like become 10 or even 20, and it really breaks down each of the rights. But the most important part or takeaway from this is that these 6 rights are to prevent medication errors and keep the patient safe. And as we know from question 1, the nurse did not follow these 6 rights. She could not have followed these 6 rights because she just took the medication from the nurse that was leaving. So she didn't grab it from the herself. She didn't do a 3-check verification. She didn't even check the patient's name band twice on 2 identifiers. So she couldn't tell if this was the right time. She wouldn't even know if it was the right dose. All of those checks were avoided, or better yet, neglected, which is an issue. And I don't think you guys have watched the video. Shout out to those who watched video 2. The patient hemorrhaged. He woke up in a pool of his blood. And that could have been avoided if she just, did her check. She could have been like, okay, I have Mr. Walters. I'm looking at my labs, because that's like part of your assessment. And she would have been like, oh, his stuff is high, so maybe I'm going to hold off, because even though it is the right patient and the right drug and the right route, it's not the right time right now because he's not eligible for this right now, because that's a contraindication. And she could have documented that appropriately and let the provider know. And then it would have saved the patient a whole bunch of stress and a whole bunch of legality for the hospital and stress for the nurse herself, because that's pretty major. He was covered in blood. So remember, guys, an ounce of prevention is better than a pound of, I just don't remember a pound of what, but I think we should all keep up the good work to becoming the best nurses we can be. And let that video, remember when we go to clinicals next week, to be good, be sound mind, and be critical, thinkers. Thank you. And now we're going off to Ohini.
And hello and good afternoon. My name is Ohini Bell. So I will start with number 3. How does medication errors impact the nurse, client, family, and the organization? So a medication error can, depending on how serious it is, can impact the nurse in them losing their job and license. Because say the nurse returns to the room and Mr. Waters was deceased from exsanguination, that would instantly be a case of negligence, and the nurse would be out of a job. Client and family, if Mr. Waters there passed, then who knows, his wife, children, they would be missing a father or a husband. And the organization, anything bad that happens at the hospital will reflect, at the hospital and other hospitals in that chain if there are any others. So, the hospital grade can go down and the reputation will suffer as well. Now for number 4, have you or a family member experienced a medical error or a near missed error? Well, yes, I have, mice actually. This was 2 semesters ago during my clinical. I was shadowing a nurse that was using the Pyxis for medications, and the computer wasn't even allowing her to sign out and leave, but still she was trying to, because she had left a medication drawer open. And as you know, that is not good at all, because who knows what medications are in there. So if you leave the room with it open, then anyone can sneak inside and get those medications. So that was actually a very important medical error. I had pointed that out to the nurse and she had thanked me and gone back and fixed